When Sheila Connor was diagnosed with ovarian cancer in 2007, the disease was already in its later stages. Connor had surgery and chemotherapy, but the cancer always returned, 4 times over 4 years.
The longest remission I've had was about 8 months.
Connor has tried a battery of drugs. One would work for a time, another would complicate her illness. Recently, she decided to stop treatment and is uncertain about the future. That's pretty typical, says Laura Shawver, a cancer researcher, commercial drug developer, and 5-year ovarian cancer survivor.
Women just go on sequential rounds of chemotherapy, one after the other after the other. They really lose the quality of life, and at the end, they succumb to the disease anyway.
Ovarian cancer comes back after treatment 75% of the time. Shawver says it's a difficult disease to treat because tumors differ widely from each other, and each responds very differently to available drugs.
It's just a random selection, and unfortunately, that means that the patient frequently gets toxicity without benefit.
Shawver started the Clarity Foundation to address this problem. The nonprofit organization offers patients a molecular profile or blueprint of their tumor. Clarity compares the diseased ovarian tumor with others in its database. It also screens for biomarkers that indicate how that tumor may respond to certain chemotherapy drugs used to inhibit cell growth in other types of cancer.
We are trying to help prioritize those choices. If those choices don't make sense for the individual, we try to help find a clinical trial that does make sense and essentially stack the cards in the favor of the patient.
Creating a molecular profile has become standard for other cancers. It's only recently become available for ovarian cancer through the Clarity Foundation. While the procedure was not around when Sheila Connor had her first reoccurrence, she says it will help others make informed decisions early in their treatment.
If you had some idea whether you would respond to these drugs, you could try something else, try another standard drug, and then if the other standard drugs don't know, then you know I need to get on a clinical trial.
That's how Laura Shawver is determined to change the way ovarian cancer is treated, one patient at a time. She says this approach can not only improve the quality of life for women with recurring ovarian cancer, it may also lead to the development of specific new drugs for the often deadly disease. Rosanne Skirble, VOA News, Washington.